finally we get to see you, Dr. Ruwanti Campano. And Doctor, thank you for having us in the office. It's just a pleasure to be here today.
Thank you.
You know, ear, nose, and throat is something that you're very passionate about, so I just thought I would begin there. Why is it that you chose that profession and to specialize in the ear, nose, and throat?
When I was in medical school, I did a surgical rotation, and one of the things I was able to witness was something called a neck dissection. And the anatomy of the neck was beautiful. I just loved all the structures. It's so intricate, so delicate in a small space, and I was hooked.
Doctor, you're very adamant about vocal cords and taking care of them. What's the worst thing that you could do to your vocal cords?
Everyone knows that yelling is bad for your voice box, but so is whispering, as well as coughing and clearing your throat. Probably the worst thing for your voice is that constant clearing of the throat that people seem to do.
You've been my doctor for a very long time, and I'm very blessed to have you. And one of the things you're adamant about is not using Q-tips. Can you tell us why?
The most common thing I see is that people end up cutting their ear canal, which gives them an ear infection, or if the Q-tip goes in too far, they actually rupture their eardrum and lose a lot of hearing. The most common thing that I find actually though is that people end up pushing the wax that they were trying to remove further into their ear canal. There's a suspicious little central depression in their wax, so I can always tell.
Being a doctor that specializes in ear, nose, and throat, ear infections are a big part of your job. With little children, is the practice of putting tubes in their ears still being done today?
It's decreased now with the advent of antibiotics. However, with children's ear infections, if they continue to have more than 3 to 4 infections in the year, then instead of potentially scar tissue forming on the drum, then a small little tube inserted in the eardrum to ventilate so air goes through the drum and that tube and out the eustachian tube could be of benefit.
There's a lot we're going to cover. There's a lot of different areas. You do facial plastic surgery, you do thermage treatment, Botox. I mean, the list is endless, and we'll get to those things. But one of the things, personally for myself, I had to have surgery on my sinuses because of chronic infections, and you were able to take care of that. What was that surgery called?
It's called an endoscopic sinus surgery. I also straighten your septum and reduce your turbinates as well, so you could breathe better.
And what's happened now is I don't have any more infections. Why is that?
We joke around and say it's like a roto-rooter. So your sinuses are big spaces in your skull that empty via tiny little holes into your nose. So it makes mucus, and if that mucus sits there, you're a petri dish waiting to get infected. And so what I do is open up those openings to the sinuses so that the mucus and potentially the pus can drain effectively.
When it comes to colds and allergies, what's your take on over-the-counter nasal sprays?
They're great in a pinch. They're good if you're having a really bad cold or really bad allergies, but nothing longer than 3 days. If you look on the box, there's a big warning saying do not use it, because what happens is the function of your nose is to humidify and filter the air so you don't get a lot of lung infections. So your nose tissue swells, and if you put something in your nose that shrinks it down, your nose says, hey, I don't like this, and it'll swell even more. So you're just going to be chasing your tail when you keep spraying that medicine.
So what you do suggest is, and you've had me make a concoction, take literally a bulb or a baster and squirt it in the sinuses. Tell us about that.
It's a saltwater solution, and salt water is what's naturally in the body, and it helps. Actually, they've done studies, and it helps the cilia, which are the hair cells in your nose, beat the mucus more effectively back. So you can make your nose a more efficient organ by getting rid of the excess mucus and the potential for infection if you clear it out. It's a natural remedy. A lot of people don't want to take medicine, and it's a natural remedy to clear up your nose and your sinus issues.
We're going to have to take a break in a moment, but one of the things that you do have a line of cosmetics. What the line encompasses what?
It's a great line that I personally use myself. The majority of it is based with green tea, and that's a natural anti-inflammatory. It lightens dark pigmentation, evens out skin tones. I also have an acne line, which is helpful for both younger people as well as older people when hormones get out of whack, and sometimes there's flare-ups of acne.
What I'd like to do right now is take a look at some of your cosmetic products. What do you say we take a break and do that right now?
Okay.